Hi, this is Dr. Wilshire at Missouri Fertility. In this video, I'm going to be discussing the informed consent for in vitro fertilization. Before we actually do the IVF process, you'll be asked to sign a consent form that will look something like this. It's called In Vitro Fertilization, Information and Consent. This is a very important document. It makes sure that you understand exactly what you're getting into, what kind of decisions you might have to make, and what kind of risks might be associated with the procedure and the process. First of all, to perform IVF effectively, a woman has to take hormonal medications to make more than one egg. In general, we like to make as many eggs as we can because the process of reproduction is very inefficient. In doing so, however, we don't want to make too many eggs because a woman can experience something called Ovarian hyperstimulation syndrome, or OHSS. With modern medication regimens and whatnot, the chance of becoming hyperstimulated is generally less than 2%. It happens very infrequently. It can be serious when it develops, however, and if you're at risk for OHSS, we'll discuss this with you before we do this so you can understand what exactly we can do to minimize this from happening. In an older woman or a woman with normal ovulation or normal ovarian reserve, the chance of this happening is quite remote. The second thing you need to understand is that we need to get the eggs out of the body. That's called an egg retrieval. That's done under anesthesia. A woman is generally completely asleep during that. And it involves putting a very large needle into sensitive areas. The risk of that needle causing damage to a blood vessel or some other organ in the pelvis is very, very low. I quote a chance of a major complication with an egg retrieval to be generally less than 1 in 10,000. This doesn't mean that it's risk-free, but with modern techniques and our extensive experience doing this, the risk is very, very low and should be not something to scare you away from doing it. Once eggs are retrieved, they can be fertilized. Most of the time, eggs are fertilized with a procedure called ICSI. With ICSI, we inject a single sperm into an egg. This ensures high rates of fertilization, prevents something called polyspermia, where more than one egg could potentially get into the where more than one sperm could get into the egg, and it prevents extra sperm from floating around, creating abnormal results in subsequent potential genetic testing. Embryos are sometimes assisted hatched, which means we use a laser to make a small hole in the shell that allows the embryo to come out. That'll be explained to you if we're doing it, and conveys very, very little risk to the embryo itself. We sometimes do fresh transfers, which means we'll make and create embryos, and if the woman's hormonal environment is satisfactory and we've agreed to this plan ahead of time, we'll take generally the best-looking embryo, transfer it fresh into the uterus, and then freeze any additional embryos, which generally we like to have. Now, more and more people and couples are electing to do embryo biopsy and pre-implantation genetic testing, or PGT. This process allows us to take a small sample from the embryo, freeze the embryo, keep it here, and send that little biopsy sample to an outside lab where its chromosomes and other genetic tests can be performed and evaluated. There's always the potential of risk to the embryo, but with my experienced lab personnel and our years of doing this, the chance of damaging an embryo is very, very low, generally less than 1%. You need to also understand that PGT genetic testing is not perfect. There could theoretically be errors. I've seen people quoting error rates of less than 1%. Theoretically, it could be as high as 3%, but error rates of PGT are generally very, very low. Now, there are instances that I call gray areas. They're not black, they're not white, they're gray. Sometimes an embryo will have some good cells and appears to have some bad cells. This is called mosaicism. Sometimes it's difficult to make decisions in these instances, and we'll talk to you about that in the future. But you need to understand that sometimes the results are not black and white, and sometimes these decisions can be very difficult. As I mentioned earlier, we like to have a reasonable number of additional or supernumerary embryos. These would have to be frozen to be used at a later date. And there's a tiny risk that an embryo will not survive the freeze and the thaw process. This is also generally a less than 1% risk. Now, there's the question of the health of offspring from IVF. Now, millions and millions of IVF cycles have been done over the years, which allows us to have very large population-based data sets. And from this, we've been able to ascertain that there is a slight increase in a genetic syndrome called Beckwith-Wiedemann syndrome. Generally, that happens in less than 1 in 15,000 offspring naturally. And the increased risk with IVF appears to be 0.01%. So it is measurable, but it is so low, it's generally not part of our decision-making process, whether we should do IVF or not. Now, most of the time we transfer a single embryo, so the risk of multiple gestation or twins or triplets or higher order is generally very, very low. In rare instances, we'll put in 2 embryos, but most of the time we're putting in a single embryo. Now, a single embryo can split and create identical twins, but that risk is generally about 1%. So the risk of high order, multiple gestations is very, very low, and you need to understand that we have that level of safety performing IVF. You need to also understand that we report our numbers. Now, your specific personal information does not go to the Centers for Disease Control, but our general statistics, the ages of our patient, the various diagnoses, numbers of miscarriages, and successful live-born babies are all put into general data sets, and these are shared with various regulatory agencies, but you need to be confident that your personal information is never divulged. So there's a basic review of the IVF process that should facilitate your ability to ask all the questions you need to ask and document that we've explained everything to you so that we can go into IVF knowing you have a full understanding of the risks, benefits, and treatment alternatives.